I would like to get into the next speaker. So, colon cancer requires a holistic approach that integrates the best of conventional treatment with functional medicine principles. So, our next speaker is Dr. Pankaj Verma. Let me bring Dr. Pankaj Verma on the stage. Welcome, Dr. Verma. How are you doing today?
Yeah, I'm great.
Allow me a minute to introduce you. So, Dr. Pankaj Verma brings over 14 years of expertise in chronic disease reversal and holistic cancer care, combining modern medicine, functional medicine, and energy healing. So, today he will enlighten us on integrating functional medicine with conventional treatment for holistic colon cancer care. So, please join me in welcoming Dr. Verma. And Dr. Verma, the stage is all yours. You may please share your presentation.
Thank you, Amajit. First of all, I would like to say you are a great host. In Ayurveda, we call them as a sutradhar. So acting as a sutradhar so that we all look like a good pearl in a necklace.
Thank you so much. That's so beautifully said. And yes, the entire conference itself is, I believe, the same thing. It has been going from one topic to another. So that sutra is also going on. So wonderful. Thank you. I can see your presentation. You can put it on slideshow mode.
Yeah. Is it visible?
Yes, it is.
Okay. So thank you. I think it's a great conference. I would like to thank everybody who is attending here and every panelist because they are giving a huge impact in the functional medicine environment it is creating over the period in India. My part here is for the colon cancer. I think in the holistic part, I would like to start with my basic allopathy. We all know the colon cancer is the second leading cause of cancer with the survival rate around 50%, 55% of 5 years. And the best part is highly preventable and highly curable if detected early. So it's rare in less than 40 years, but the rise of this new modern era is again coming in 30s also. At presentation, 37 localized, 37 regional, and 20% is metastatic. All the inflammatory disease put the patient at more of the risk. Possibilities, if you see the all the GI cancer that Dr. Gaurang already discussed, there's a possibility of many cancers in the GI. Polyps, lymphoma, leiomyosarcoma, carcinoid tumor, Kaposi sarcoma, all the malignant diseases from the adjacent sites like prostate, ovary, kidney, uterus, stomach, all these, they may present as a primary site in the GI. So there are many kind of polyps which can develop in the colon. Most of them are usually non-neoplastic. There are types of hyperplastic, inflammatory, lymphoid, juvenile polyps. Adenomatous polyps are relatively common, particularly in the elderly. As usually we age, the number of polyps in the colon grows rapidly. So what's the pathophysiology? I think it's the very first step that we read in the second year of the pathology in MBBS. We all gone through it. So that's a normal path of how the one polyp become develop from benign to malignant. There are multiple insult and the mutations which happen during the course, which lead to from normal epithelia to dysplastic, then KRAS mutation, which lead to adenoma, and then the P53 mutation, which can lead to carcinoma, and then multiple further insult, which can lead to metastatic cancers. So this is how the colon look like. Dr. Gaurang has already said how that lead to the loss of tight junctions and then lead to leaky gut, which lead to lot of inflammatory cascade in the gut. I'm trying to going faster because we all know about it. What are the factors which lead to colon cancer? We all know the inflammatory states: diet, red meat, animal fat. Uh, uh, the alcohol consumption increases the risk. Mainly the diet plays a very significant role. Of course, the genetics plays a key role also here. Calcium supplementation may decrease neoadenoma. Folate is protective. HRT, aspirin, NSAIDs may have some protective role, but still undefined. So progression, if you see among the polyps, in 30, almost more lesion which are having most cancer are having 60% single, 40% multiple. Invasive cancer developing 20% if they are untreated. So we already discussed types of polyps. Among them, tubulovillous polyps have a most risk of acquiring cancer over the period. Similarly, any cancer, any size having more than 2 centimeter, again also having more development of malignancy inside them. Inflammatory bowel disease, we all know it's quite common nowadays because of the lifestyle factors. Ulcerative colitis poses a huge risk. It increases the risk of carcinoma 30 times than general population. Similarly, Crohn's disease can also have 10 to 20 folds rise in the cancer. And that's why need to surveillance is very much required. Any patient, if I see, I do mainly a physician practice in the hospital, any patient who's age more than 50 years, coming with unexplained anemia, any male especially, you must screen them for GI cancer. That's a very important rule to follow because usually males do not have any site to lose the iron, and any anemia should be thoroughly investigated in these kind of patients, especially if the age is more than 50. Usually, I have seen almost 40 to 50% of them will be having some kind of GI pathology, either ulcer or benign or malignancy, but usually they turn out to be malignant. The colonoscopy is the main procedure of choice, must be done in every patient having symptoms of anemia, occult blood, any constant non-resolving GI complaint. Because we all know the normally GI complaints are very, very vague. They may end up presenting with some constipation alternating with diarrhea, intermittent bleeding from the rectum. There may be constant pain in the lower abdomen. These are very, very vague symptoms. But if it is not responding with conventional therapy, you must try to find out what the exact cause. So what is the treatment option for the colon cancer? We all know we can go for surgery, chemotherapy, radiation therapy, targeted therapy, immunotherapy. Surgery is the most common cause and most common treatment for all stages of cancer, colon cancer. And polypectomy can be done, local excision can be done. I think Dr. Gorang is the most skilled person in this kind of treatment. Similarly, we can go for, if the in the case of adenomas, we can go for radiofrequency ablation, we can go for the cryosurgery. Radiation therapy and chemotherapy are the crucial part of colon cancer treatment. There are two kinds of therapy which we can go for: neoadjuvant therapy, another one is adjuvant therapy. Neoadjuvant therapy is basically the treatment given before surgery to reduce the tumor burden, and the adjuvant therapy is the treatment that we give post surgery to reduce the further cancer recurrence. So in the chemotherapy, we can there are many kind of chemotherapy agent which can be given. I think that's the main part of oncology treatment. Targeted therapy, they are very, very common nowadays. If you can exactly identify the real biomarker, you can target the therapy with bevacizumab, cetuximab. There are many kind of monoclonal antibody which can be given depending on the patient testing biomarker. So now here the main part start. How do we approach in the holistic colon care treatment? First of all, the most important is finding the root cause. And then the anti-inflammatory diet. This is the main protocol that we follow. Ozone therapy, supplements, vitamin D, Ayurveda Prakriti analysis, Ayurveda anti-cancer concoction that we call natural extracts, probiotics, energy healing, deep subconscious belief system consideration. So coming one by one to it. Finding the root cause. We have studied the physical part of it. We have studied the mutations that we hold, that we have over the period. But the issues may be in the physical body, in mental body, in vital body, in energy body. We have 5 layers of body in Ayurveda and in energy medicine. So the issue can lie anywhere, even inside the body or and outside the body, in mental body, energy body, supramental body. So we have to address where the root, what's the exact cause of cancer inside the patient. In terms of diet, we all know, we already touched upon on the gut microbiome, the role of plant-based diet, fruits, vegetables. These play a significant and key role. Herbs and spices, paprika, rosemary, ginger, turmeric, sage, cumin, cloves, cinnamon. All these are very, very good for colon cancer patient. Similarly, green tea, white tea, all the tea which having good polyphenols, antioxidant are good replacement for normal conventional Indian milk tea. Omega-3 fatty acid again have a good anti-inflammatory response. Fiber, I think we already discussed about the role of fiber in the gut microbiome. So what's the basic to reduce the inflammation? Eat fresh, simple ingredient. Avoid fruit juices. Take more whole fruits because fruits are acidic and high sugar. You must stop alcohol or replace your basic diet with more organic food. Avoid taking soda, cold drinks, processed meat, and blue cheese. Now, autophagy play a major role in degradation of all. I use autophagy in many cancers. Autophagy, what's the role of autophagy? It basically inhibits degradation of damaged component and protein oxidative stress cell, leading to development of cancer. So basically, in initial stages of cancer, autophagy works amazingly, but in the late stages, it may work paradoxically. So autophagy acts in an anti-metastatic role via limitation of cancer necrosis and inflammation response in early stage of cancer metastasis. In early mets, autophagy also reduces invasion and migration of cancer cell from origin site. And this dysregulation of autophagy have been implicated in many cancer and inflammation disease like neurodegenerative diseases, cancer, IBD, inflammatory diseases, CA liver, colorectal, gastric, breast, and all. So how to do induce fasting in the body? We all know fasting is the most effective and trusted way to trigger autophagy. But some medicine can also induce the autophagy response in the body, like rapamycin, mTOR, and hydroxychloroquine. So when the body is on the low on the sugar, it brings the positive stress that wakes up the surviving repair mode and lysosomal activation inside the body. Similarly, ketosis can also benefit the patient, especially both those patients who cannot do autophagy in complete form. Those who are having stage 4 cachexia patient, they should not go for complete autophagy. I will tell my one patient example. In 2018, I have one patient of squamous cell carcinoma of the throat. He presented to me with the 10 centimeter of the mass. It was a solid tumor. And he has done the fasting of 96 hours. That's tough to do, but he has done because he was advised for the complete surgery of removal of the tongue and all in the AIMS, New Delhi. And after 10 days, we have done the CT scan before doing the autophagy, and we have done the CT scan after doing 5 days of autophagy. The tumor reduction was amazing. It was initially 9 centimeter, which bring down to 2 centimeter in the period of just 7 to 9 days. And after that, he underwent stereotactic surgery in the AIMS, and he's still till 2024, last 6 years has been passed, he is still tumor free. So autophagy has great power. I've seen, it's my personal experience, solid tumor have a better response to autophagy. So what we all know what we can do. It's a no carb diet. There are multiple level of fastings. I usually prefer liquid diet. If the person cannot do liquid diet, they can be shifted to fruits diet. If they can't do fruits diet, they can be shifted to keto diet. If they can be shifted to partial keto diet, Dr. Nanda's favorite. Intermittent fasting is again, it's very common term, but people don't, most of the patients do it wrongly. As per my experience in Indian context, in according to Ayurveda context, it should be done between evening 6 p.m. to morning 8 o'clock. That is sufficient. If you extend beyond it in the daytime, it will not synchronizing with Indian circadian rhythm of the hormones. That's why it's better is you must take early breakfast, and you should skip the dinner part in the Indian context of intermittent fasting. And usually the tough part to do autophagy is most effective when it should be done more than 72 hours. But usually patient don't do it. So 24 hours is good, 36 hours is better, but 72 hours is the best way to if you actually want to have the great impact of lysosomal activation and detox the whole body. Similarly, in Ayurveda, I will come to it. Vata Pitta configuration must be defined for the patient, because all the patient, everybody is having different kinds of prakriti, different kind of nature of their body, and you must take into consideration whether they are able to do it in what form. Supplements, omega-3 is a great supplement in colon cancer. Curcumin is again very effective. Vitamin C we are using in oral form and IV forms also. IV vitamin C is again very effective to reduce the inflammation. Pomegranate juice is again very effective. It's acts as anti-cancer in most of the patient. Zinc carnosine is also a good supplement. We already discussed these in our cancer. That's why I'm giving it in the short way. Vitamin D plays a great role in homeostasis of many cells. It regulates the homeostasis of intestinal epithelium by modulating the oncogene WNT signaling pathway and by inhibiting tumor-promoting inflammation. And so these both activity contribute the ability of vitamin D to prevent the development and progression of colon cancer. It also leads to positive shift in microbiota. So nowadays, several studies has confirmed that increasing vitamin D levels lowers the colon cancer incidence. It reduces the polyp recurrence, and then sufficient level of vitamin D is associated with better overall survival of colon cancer patients. And the good part, the main part is should be given in the high doses. We all know the Coimbra protocol, Dr. Renu Mehtani, the lessons we have learned. I'm using in the dose of 20,000 IU to 60,000 IU per day in the patient of colon cancer and in the patient of any cancer that we are dealing with. Probiotics, Dr. Gaurang has explained in an amazing way the role of gut microbiota and how important is to give probiotics and prebiotics in CA colon. So probiotic may help by suppressing cell proliferation, it promoting apoptosis and reducing the diarrhea. There are many probiotics which has been under consideration, but bifidobacterium play a good role. If I come to L. plantarum, again has a good role. L. casei has a good role. L. lactus rhamnosus, bifidobacterium brevi combination works good in reducing the several cancer biomarkers. So these are the probiotics which has been studied in the research with different kind of function. As Dr. Gaurang explained, the future will be to study the microbiome and to then ultimately targeting the exact flora which need to be given, which need to be replaced, but depending on the patient expression of different kind of whether they are positive in some bacteria or negative response in some bacteria. So these bifidobacterium, bifidobacterium brevi, longum, thermophilus, lactobacillus acidophilus, these have a good role in tumor cancer prevention. So Dr. Gaurang has said, it can have both role. It can also, unhealthy microbiome can promote the cancer and healthy microbiome can reduce the cancer burden. So probiotic have beneficial, what's the conclusion? Probiotic have beneficial effect in patient with colorectal cancer regardless of the stage of cancer. So in any stage of the cancer, you can give probiotics after studying the microbiome of the individual patient. Ozone therapy. Ozone therapy I'm using in every patient of cancer. I think that the most effective holistic treatment that can be given in all the patient as a complementary therapy is ozone therapy. Dr. Milisha has taken a good lecture yesterday regarding the role of ozone therapy in cancer. So that's how it's very effective in all kind of, especially GI sense cancer, like CA colon, CA rectum, CA liver. These are ozone therapy is very, very effective. Okay, so the different I'm using is again Ayurveda. Ayurveda I'm using in my every patient. We do Prakriti analysis. We do Vata Pitta Kapha analysis. I will come to it. There are what kind of therapies available in Ayurveda? We can give enemas, where various herbal decoctions enema. Where we can do virechan, that is catharsis and diarrhea induction by the under guidance with the help of medicines. We have anti-cancer formulations with the name of Biokin that I'm using for last I think 8 years. It's worked very good in all the cancer patient. As the Dr. Gorang said, it's a natural extract having a good anti-cancer properties. And again, Prakriti-based diet should be given. So what is the Prakriti? Basically, we all know we all made of 5 elements: air, ether, fire, water, and earth. But in every person, the amount and proportion of these elements is different. So according to them, the Ayurveda divide them between the Vata, Pitta, and Kapha. In the Vata, we have more of air and ether, means space component. In the Pitta, we have more of fire and water component. In the Kapha, we have more of earth, means solid and fat component, and water component. So everybody has a genetic fixed nature by default, but you can develop distortion or vikriti over the period. So you may have Vata or Pitta Prakriti. Nobody is having a single identity. Usually everybody is a combination of some of those. Like my Prakriti is Pitta and Vata. So Pitta Vata means you have a good amount of fire and water and some amount of air and ether. So in the colon cancer, the main issue is between the Pitta dosha and the Kapha dosha. Means if your fat is abnormal, if your fire is abnormal, if your gut is abnormal, if your water is distorted in the body, then this can lead to the colon cancer or any kind of cancer over the period, especially related to GI. In my experience, Ayurveda works very, very good in all the GI cancer because Ayurveda deals mainly with the gut part. That's why how it's working better in Ayurveda. Okay. Now, we have discussed the physical body and now we are dealing with the energy body. In the energy body, we all have issues. In the quantum science mechanism, we all say issues in our tissues. So our unfulfilled desires, our ambitions, our blocked emotions. There's a book called Theta Healing by Vienna Stubble, which determine the how emotion can lead to disease, any specific disease. So if you're talking about emotion, your blocked emotion, emotion of hate, emotion of guilt, emotion of anger. These all negative emotion can lead to cancer inside the body if you are holding them inside your body for a long term. So that's why in energy healing, we have energy healer working with us, Sadhna Mehtaji. We do past life regression, we do hypnosis, we do inner child healing, we do childhood trauma healing. In the body talk, we deal with quantum science mechanism to access the body. In the body talk, we just talk with the body, not with the patient, and it can target us the behind the exact cause. What is the priority of the body to heal with? That's why we always say forgiveness and gratitude is the good emotion to have with, because they try to cleanse your inner system. They try to clean your energy body. Every patient is having blocked emotion. They must be having some issues. Like most of the fascia that we having tightened fascia around the cervical, around the neck. We have a tightened fascia around the back. If you are having any burden, any responsibility, these issues can further aggravate inside the body. So that's why I told you theta healing, the belief system healing is the very, very important part of the cancer treatment. Because what I have seen in my practice, anybody who is having negative mindset, like I'm having cancer, I won't survive now. they won't be able to survive at all despite whatever you can do with them. But if somebody is hopeful, I have seen patients of 80 years, 90 years having good, very good response with these kind of holistic cancer care treatment. I'll give you one example. There's there's one patient who's not a colon cancer patient. He's a patient of brain tumor. He has optic chiasma lesion around 2 to 3 centimeter, and he has underwent 2 times surgery with again recurrence. He is 78-year male, and now he is with us for last 1.5 years. He came with complete loss of vision in one eye and partial loss of vision in another eye with complete ptosis of the left eye. And we started the treatment with the help of hypnosis. We have given him magnet therapy, we have given him ozone therapy, and we have given him biochem. And the MRI has shown the significant recovery and reduction in the size after 8 months after doing 30 or 40 sessions of ozone. According to me, ozone works, but in the holistic treatment, we don't know what's working better and what's the proportional amount you can attribute to one healing regimen that you do. But yes, that patient is working very well. Now is 80 years. He is having both eye vision is much better. The ptosis is completely gone, and he's dealing greatly with his life because he is hopeful. His wife is hopeful. They are very positive about it. They have a faith, complete faith. Yes, whatever we are doing is right for them. So these all things, especially the faith part, the positive mindset of the patient plays very important role in the healing of cancer, because whenever we deal with the cancer, we always talk about the medicine and the physical part, but the most important is your mental health. If mental health is not good, if you're not hopeful, if you think cancer is the death of a life, end of a life, then nobody can heal you, whatever you can apply. So the take home message, all cancers are multifactorial. The issue can lie in physical body, mental body, vital body, supramental body. Epigenetics plays significant role, and that's why we are now playing more and more emphasis on epigenetics, because you can't change the genetics. Holistic approach is most rewarding. Diet and autophagy play key role. I use autophagy in my every patient, whether it is diabetic or fatty liver or cancer. Probiotics, we all know about it. Ayurveda works better in GI cancer. Ozone therapy is the best complementary and anti-cancer therapy. And I'm very happy to share that people respond very well to ozone therapy. And the last but not the least, focus on subconscious healing by focusing on belief system modification and constant support. Thank you.
Wonderfully explained. Again, another wonderful insight. You can see a lot of expressions coming from the audience. Just give me a minute. I would request you to either stop sharing the screen. Give me a minute. All right. Okay. Perfect. So, Dr. Verma, undoubtedly wonderful insights over there. I can see a lot of claps and expressions from the participants. Lovely audience there. Thank you so much for telling how it is. And I just wanted to read, before you leave, Dr. Verma, from the stage, I wanted to read out one of the participants itself said, and I believe that's what everyone is saying. This is so heartening to hear, Doc. Applying the principles of Ayurveda, following Prakriti analysis, and deciding treatment accordingly, we must draw on our ancient wisdom to heal current human illnesses. So, I think this is the conclusion that even a participant had to give. What you had given. So, no doubt, a beautiful presentation over there, Dr. Verma. Yes, we do have a couple of questions. And if possible, I'll just take one of the questions very quickly. Keto diets are mentioned as useful, but don't most ketos advocate red meat and animal fat? Kindly clarify.
Yeah. So I'm using the partial keto diet and I'm using the vegan keto diet. I'm not using the animal protein in the diet. And as I said, most of the patient of stage 4 patient are basically very cachexic. So they can't go for complete autophagy. So it's better to shift them on the positive keto diet. Like I'm giving more of nuts. I'm giving soaking the nuts is also very important that Gaurang has said to avoid the anti-nutrient part. And I'm not using animal protein in the keto diet. I'm not using even paneer also. I'm just using simple nuts and ghee and coconut basically.
Wonderful. Sometimes we really miss out on the simple things. And simple things make a major difference. So, all throughout, it has been very, very insightful and very nice to hear the ancient wisdom definitely coming back into the mainframe. Thank you so much for being here, Dr. Verma.